We begin tonight with the pandemic. Right now, the U.S. has more than 4.1 million confirmed cases. More than 147,000 Americans have died. Yesterday, the World Health Organization reported more than 284,000 cases of coronavirus in just 24 hours. That is a new high for a single day of global cases. Most of the cases come from a handful of states: Texas, Florida, California, Georgia, and Arizona. Joining us now are Matt Wellington, the Public Health Campaigns Director for the United States Public Interest Research Group, and Dr. Joseph Fair, an epidemiologist and NBC News science contributor. Good to see you all tonight. And we should also mention that Dr. Fair is in New Orleans this evening. New Orleans had already stopped indoor bar service, you may have heard. As of today, it also banned takeout alcohol service known as Go Cups because of a rise in coronavirus cases. And Dr. Fair, I know this sounds minor, but I want to start with that slice of life in New Orleans. We will talk about the bigger issues of deaths and infections and testing and all that. But just in terms of day-to-day life, what does banning Go Cups mean for New Orleans nightlife, or lack of, at this point?
I have to tell you, banning Go Cups is kind of like one of the seventh seals have already been broken. You know, I mean, we know we've approached something very serious if we've actually banned Go Cups, which is such an essential part of our culture here in New Orleans. So why would you waste a perfectly good drink when you can take it out on the street with you? That being said, we do know that alcohol lowers your inhibitions. It's one of the reasons we all like it so much. But in the case of coronavirus, lowering those inhibitions leads to, lack of social distancing, people mixing, getting together in groups larger than they should be, and essentially spreading the virus. And it's been demonstrated again and again since the onset of this pandemic.
Matt, yesterday, the U.S. Supreme Court rejected a request from a church in Nevada to challenge limits on the number of congregants that they're allowed to have at services. We mentioned this earlier in the program. What do you make of this ruling?
Well, frankly, I apologize.
Well, that's all right. Go ahead, Matt.
That's okay. Yeah, thank you. I was just going to say, I think the only thing I would say about it is we know the more people are in close spaces, the higher the risk of spreading the virus.
Dr. Fair, the CDC released guidelines this week for schools to reopen this fall. What do you think schools should be doing at this point? Do the guidelines answer most of the outstanding questions you have?
Not at all. And, questions I would have as a parent and, making me feel comfortable enough to send my child to school, the CDC guidelines as of now do not do that. And the fact that, we're canceling the RNC convention and we're still going to allow students to go forward and go to school in the fall. Just to kind of give you an equation, every time we do an animal experiment when we're like working on vaccines and that types of things, we go through what we would call ethical review boards. Sending children to school with a pathogen present that we have no idea really what it's going to do to them, what's going to happen to them on a larger scale, if any of them are going to get sick enough to die, if we're going to see more things like the Kawasaki syndrome, that experiment would never be approved by an ethical review panel. And that would be for an animal. So you can imagine that thought of, sending your children to do that. And I get the importance of sending your children back to school. It's key to everything. It's key to our economy. It's key to their lives. It's key to establishing some type of normalcy. But until we get the pandemic under control, we're not going to have any type of normalcy of what we had pre-COVID-19.
Matt Wellington, with regards to that, it would seem that push has rapidly come to shove as it relates to getting kids to school and getting the economy cranking at full steam again. Is there, in your view, Matt, no way to safely return kids to campus so their parents can get back to work? Is there some way to make this work that you would be comfortable with?
Well, I think it comes down to what Dr. Fair said about getting cases down. We know we're seeing uncontrolled spread in almost half the states across the country. We know we're nowhere near where we need to be on testing and tracing capacity to be able to squash future outbreaks before they explode. And so I think what we do right now is going to have a huge impact, not only on whether or not we can reopen schools safely, but on how many lives we can save, not only in the short term, but in the long term. And if we can actually reopen this country safely. So I think it really all comes down to what policymakers decide now, and we're urging them to take bold action to save lives.
Matt, let me stick with you for a second. You've been pushing for America's decision makers to, in your words, shut it down, start over, and do it right. You've been calling for stricter guidelines to stop the spread of COVID. I think everyone is kind of ready for this to be over. Even those of us who are 100% in favor of social distancing and hand washing and wearing masks have various creature comforts we're kind of eager to have back. I would give anything to have one gym open within 100 miles of where I live right now in New York. If you were in charge of the federal response to this pandemic, what do you think is the one biggest policy, the one most important plan you'd put in place to stop cases from rising and to get us back to normal faster?
Right. And I hear you, Joshua. I think people have been through this. It's difficult. If we were in charge of the federal response, I think there's a couple key things that our government needs to do. Number one, it's to hit the reset button. It's to make sure that we're slowing down the spread of the virus. That means closing non-essential businesses in much of this country. It means limiting interstate travel so we can contain it. And also mandating that masks are worn in public by everyone across the U.S. to limit transmission. Number two is that they have to take the time that those kinds of measures will buy us to rapidly ramp up testing and tracing infrastructure in this country so that we can contain outbreaks and to produce enough personal protective equipment to keep healthcare professionals and frontline workers safe. That's a problem we've been struggling with since March. It is not solved, and that's a travesty.
Matt Wellington and Dr. Joseph Fair, appreciate y'all starting the hour with us. Thanks very much.